Hi, everyone. My name is Kay O'Neill. I'm one of the HARC coordinators based here at Johns Hopkins University, and we are really thrilled to welcome you all today to our very first in our new webinar series. We had a really great response for attendees for the meeting, so we're looking forward to a great session. Today presenting we have Dr. Brenda Jones-Harden, Dr. Deb Darrow, and Dr. Erica Lewis. Brenda and Deb are members of our HARC leadership team, and Erica is a member of our National Advisory Council. I know for many of you, this might be the first time you've heard of HARC. This webinar is an introduction to home visiting research and some of the different opportunities and in our field. So we are looking forward to introducing all of you to HARC and to home visiting research. At the very end, there'll be some announcements for opportunities in the future. And so we hope you will take advantage of those and want to continue engaging with us. Actually, Diane, if you can go to the next slide, I will acknowledge our funder, which of course, as always, is the Maternal and Child Health Bureau. So of course, we always thank our funder, the HRSA, and the Maternal and Child Health Bureau. So I think with that, I will pass it on to Brenda.
Hi, everyone. So happy that folks are coming to hear about this. This is an exciting first step for us. We are really trying to get the new group of home visiting researchers. So all of us who've been doing this for a long time can go do something else, like travel the world. So we are very interested in seeing a new crop of you all. So we're excited to have you here. I'm going to go on to the next slide and just tell you what we're going to do for this webinar. I'm going to do some introductions and talk about the goals in just a second and describe HARC. We're going to move to Deb Darrow, who's at that point going to talk about career development in home visiting research with a particular focus on some of the emerging issues. And then, as Deb and I like to say, we're going to have the star of our show, Erica Lewis, who is more of an early career person than Deb and I are, who's going to talk about her own trajectory, how she was able to build her home advice and personal reflections. We're going to then have you ask some questions or give some reflections if you'd like. And then we're going to talk to you all about our next step in terms of what we're thinking about with our goal to build a new group of home visiting researchers. Okay, so that's our agenda for today. You can go on to the next slide. So let me start with the introductions. I would invite everybody who is here to put your name and affiliation in the chat if you don't mind, so we can have a record of who came and reach out to you for some of the things that we're planning. And I just want to do a quick introduction of myself and Deb and Erica. I am a professor of social work at the Columbia University School of Social Work, but am also professor emerita at University of Maryland, where I spent close to 30 years of my academic career working in the human development department there, as well as the School of Social Work. Deb is a senior scientist at Chapin Hall, and you all may have seen her name many, many times because she has certainly done decades of home visiting research and also has more recently started to help us think about creating early childhood systems of care. She is also, as you heard, a member of the HARC leadership team. Erica Lewis is an associate professor. I was there to witness her get tenure, so I'm very excited about that still, as you can tell. She's at the University of Maryland School of Social Work, and she is important for this particular webinar because she's going to talk to you about her own personal trajectory building a home visiting research agenda. So those are the three of us, and we're going to move through this really quickly, so we're not going to than that. Let me just talk to you a little bit about what our goals for today's webinar are. We really want to start to create a shared learning space for you all, for early career researchers. as a way of supporting you to engage in home visiting research. That's our overarching goal of this webinar experience and exposure to HARC is doing, as well as what the home visiting field research writ large is doing. And then again, our overarching goal, as I said from the very beginning, is hopefully to really contribute to the building of the next generation of home visiting researchers. So that's really a summary of our goals. So we can go on to the next slide. So I want to talk to you a little bit about what HARC is. That acronym stands for a Home Visiting Applied Research Collaborative. And it really is to provide a platform for home visiting research and development on a national scale. So it brings together all kinds of people who are researchers, but also practitioners, system builders, et cetera, in the home visiting world to advance home visiting research. The overarching mission of HARC is to broaden and strengthen the benefits of home visiting through this kind of research, innovative research, but always with this goal of translating research to practice and policy. That is the primary mission of HARC. And then the overriding question, the overarching question, research question that HARC attempts to ask in all of its activities is what works best for which families, in which context, why, and how. So you hear the mechanisms, you hear the components, et cetera, that HARC is trying to do a deep dive into, in many ways summarized in sort of a precision paradigm, but with that age-old question that we've been encouraged to ask in all evaluation research about what works best for whom and why. Okay, you can go into the next slide. So what does HARC do to achieve that mission and to answer those very important questions in the field of home visiting research? One, you heard me mention there's this practice-based research network that really is an amalgam of researchers, practitioners, policymakers, systems builders, et cetera. We try to respond to emerging home visiting priorities, some of what Deb is going to talk about today. We advance the use of innovative research methods. So you may have heard that we did a session last year around innovative research methods in the field, promoting data sharing and interoperability so that we can connect home visiting research to all these other early childhood research fields. And then important to our goal here for this webinar is to mentor the next generation of researchers, which is what we're trying to do today. And then obviously, to expand the precision home visiting research agenda, which is part of that last overarching question that I told you all about. Okay, you can go into the next slide. So I'm going to turn this over to Deb, who's going to start to talk about career development in home visiting research. So Deb, you're on.
Oh, great, Brenda. Thank you so much. I really want to welcome everyone here. This is an opportunity. I think we want to introduce you to a variety of pathways in which you can join the home visiting team, that you can be part of those people that are taking a critical look at home visiting to make it better, and more importantly, to improve outcomes for families and their children. Next slide, please, Diana. So when we think about home visiting researchers, what kinds of things do they study? Well, they study the topics that continue to challenge program implementation. I don't care what kind of program you're doing. It's never easy to implement these programs. And people that do home visiting research spend a lot of time looking at those challenges. They also spend a lot of time highlighting new or emerging issues that complicate service delivery, issues that are somewhat reflective of the traditional challenges we face in doing high quality programming, but more importantly, are a slightly different slant on this old story. And then finally, home visiting researchers sometimes stay within their field of study, their major discipline, but they think about how home visiting might be used to address broad, very difficult social problems. Diana, next slide. So when we talk about what are those kinds of things that we've called enduring issues that surround home visiting service delivery and sustainability, they're really the bread and butter issues of a number of people that look at home visiting programs. They stay, what you might say, they stay within the box Many of these issues are more acute today for a variety of reasons, not the least of which is COVID's impact on our daily lives and the routines of families. But they also but they don't challenge the fundamental structure or approach of doing home visiting programs, or what we would consider to be the service delivery process. I like to think of them as issues that are of degree and not kind. So what are some of these enduring challenges? Well, the application of reflective supervision. We're seeing this more and more now for both home visitors as well as supervisors to improve quality. We want to have high quality supervision, but how do we do that? How do we really implement it? There's a lot of questions around that. There's a lot of questions about adequate and appropriate timely onboarding of professional development staff for home visiting. There's continued questions. This has been an age-old problem in the prevention field about more effective participant engagement strategies. The thing about prevention to keep in mind is we don't mandate people to prevention. We offer them opportunities. And so there's a lot of degree in which families have to want that we have to bring them in. We have to encourage them to participate. And sometimes our efforts have not been as successful as we would like. And that continues to be a challenge, and many people are examining it. We have to identify effective ways to establish, strengthen, and sustain provider-participant relationships. You know, for the most part, this is a relationship-based program. It's central to what we need to understand. How do we build those relationships and strengthen them? We have to understand the idea of tailoring program content to specific family needs. We know this isn't a cookie cutter program. We don't do the same thing for everybody. Brenda alluded to it with the precision paradigm model we've been working with so diligently in HARC, is that people need different things under different circumstances and for different reasons. And how we do that and still maintain the fidelity of the program is a challenge, and a lot of people spend time looking at it. People are spending time looking at collaboration and coordination. You know, historically, home visiting is a program that has two missions. It has its own portfolio of what it's trying to do with families, but it also is a window on the world, if you will. It's a window into community services, and it helps families navigate what is in most communities a very complex service delivery system. A lot of folks that do work on home visiting look deeply at that system and what they can do about it. We also know that families sometimes need more in-depth clinical or remedial services than what we can do in home visiting. Maybe they need to be mandated to certain sort of clinical interventions. These are things, again, that home visiting researchers are trying to understand. And then finally, as with all programs, you do have to look at what your funders want and how can we make sure we're giving funders what they need. These are largely publicly invested programs. The public wants to know their dollars are well spent. And so many home visiting researchers spend time documenting that indeed investment in home visiting is good investments for families. So we can go to the next slide. In addition to these kinds of enduring issues that you'd see, I don't care where you are in doing a service delivery program, we have spent the last year or so looking at what I call emerging issues in the home visiting field. So what do I mean by emerging issues? I think they're issues that are related to conditions that could not have been predicted. You suddenly find yourself almost in a new space on a different planet, and you're trying to sort out what needs to happen now and why is it so different now. We're looking at ongoing implementation issues that have grown increasingly complex. We used to know how to do supervision, and now somehow it's more complex as workers demand more support. The challenges of sustaining a workforce become more acute. Those are different. So it's a slightly different take on what we've been normally doing. I think challenges that resist traditional problem-solving techniques, new issues for families that we just are a little bit at a loss on how to solve. And then I think there are situations that require new thinking and innovative approaches to tame them, what some have called in the planning field, wicked planning problems. So next slide, please, Diana. As we've been talking about this over the last year, and we've been interviewing our colleagues that operate in the home visiting field from a variety of perspectives, be they public funders, federal funders, state funders, services, the national home visiting models, the advocates that are trying to sell the expansion of home visiting to Congress and to state legislators. What are we have identified 6 primary issues that people really see as enduring. issues that really open themselves up to very detailed research questions that can create, that we need to begin to understand these issues so we can actually advance the field to the next level. So what are these issues looking like? First, defining and applying an equity lens to all of our assumptions, or really make it very difficult for us to continue to do our work. How do we navigate those? Lots of research questions around that. And then we're also looking at redefining, as Brenda has talked about, and Allison has certainly highlighted in presentations we've done at the recent summit. It's about understanding how high impact research looks these days. With the old days of it would be a randomized clinical trial, we would all know it when we saw it. We're a little less certain now about what makes high quality research. And remember, the kinds of research that home visiting programs do is not just to do it for the sake of doing the research, but it's for the sake of it actually changing the policy and practice in everyday life. And what kinds of research we need. Is that going to be research defined just by researchers? I suspect not. I think it's going to involve a lot of community input, community participatory research as we go forward. And then finally, I think we're increasingly looking at the need to balance the idea between offering something to everyone, a universal platform of support, so that every time somebody has a baby in this country, somebody says, what are you going to do about it? Do you have what you need? How can we help you? How can we build a community of support so that you can succeed as a parent? In the absence of having that, can we possibly have the resources just to keep targeting and picking off families that, for whatever reason, we think they're with the problems? I suggest a balance between those two strategies. Maybe I'm editorializing a little bit right now, but this is what I truly believe after 50 years of looking at these programs. I'll tell you, unless we come up with some balance between leveling the playing field for everybody and then being able to do some targeted services that best suit those families' needs, I don't think we can win the battle and have the programs we most need. Next slide, please. So these are very traditional ways of thinking about home visiting. They're very focused on home visiting. People that do home visiting research attack a number of these issues and do a lot of work in home visiting. Indeed, for a long time, I think we thought home visiting researchers were special because they worked so much in home visiting. Now, I think, though, that a lot of people that I'd like to think of thinking more broadly about home visiting in a variety of contexts in which we work. Many of you think of yourself not as home visiting researchers. You may be here because you're a child welfare researcher, or you're an economic researcher. You're really worried about family income supports and access to basic resources to meet the material needs of their families. Some of you are healthcare providers and you look at healthcare access and quality, and you're very happy in the healthcare realm. I was noticing as people were listing themselves in the chat, a lot of you work in healthcare settings. Some of you are all about birth to 5 service pipeline. You want to understand childcare. You want to understand how early care and education supports parenting and families. Some of you want to look at optimal child development. Brenda Jones Harden is an excellent child development researcher. She does home visiting, but a lot of her identity is understanding child development. And then also the idea of equity and well-being. Some people want to look at that. That's where their passion is. So here's what I'd like to raise another way you think about home visiting to advance your career. Let's say you find yourself identified in one of these buckets. And I want to tell you, you can still be part of the home visiting team and not give up your passion. You don't have to change yourself name to be, I'm a home visiting researcher. You can still be a child welfare researcher, or a health researcher, or a child development specialist. But what you're going to try to do is ask yourself, how could home-based service delivery, the working with families in a one-to-one situation in their home or in a reasonable facsimile to their home, if we decide to go virtual, can really help resolve some of these more systemic, difficult social challenges that we most certainly face going forward. I also would say that a lot of these domains have a lot more money that's available than home visiting. So if you can go to the health department and say, I'm really worried, I'm really concerned about improving healthcare access, and I'm going to show you how home visiting can help do that, you can use their resources to answer some of our home visiting questions. So we're in a kind of an eclectic group, these home visitors. We're not monolithic. We're not monogamous. Some of us have had different careers in different fields over the years. But we keep coming back to this idea, what is it about home visiting that makes it may not be the only way to solve problems, but we know that it's a really good bet. So how can we introduce that concept and interest in this intervention to many more fields going forward, and how you can be part of our team? So, and there's one last slide, Diana. Oh, no, I guess there's not one last slide. I will tell you what we're thinking of doing with this. I just want to leave you with the thought that home visiting is a rich field with a lot of different ways in which you can make progress on improving the service delivery itself, as well as change progress in other domains. I want to remind you that the HARC membership is a diverse group of people that can really help build your skills in two ways. Your skills around using methods, different kinds of methods. And then secondly, this policy application that Brenda mentioned comes back to the people that are members of HARC and do this work, understand the policy ins and outs, understand the pitfalls and opportunities, and we can help work with you on that as you advance your career. And then I think we can also work in partnership with you and others in the field to make sure that we eventually have the resources we need to get the job done in helping families. So with that, I'm going to turn it over to Erica Lewis. I would be amiss if I did not say one more thing about Erica. Some of you know I ran a fellowship program called the Doris Duke Fellowships for the Promotion of Child Wellbeing, and Erica was one of our stars. From the very beginning, she was a star, and I am so thrilled to have watched her career develop and evolve. And one of the lessons I hope Erica might mention, but if she doesn't, I'll mention it anyway, is that it was about the network. It was about the partnership. These were young scholars that cared about each other, not just about their work, but personally cared about their well-being and how they were going to build their careers. And I think as we think about building a career in home visiting with HARC, we want to create that same ambiance, that same sense of partnership and friendship. So Erica, the floor is yours.
Thank you. And I am going to talk about that. So this is a very full circle moment, because I think the main part of my presentation is that you can't do this work in silo, that you need to stay connected and be connected. And so to have connections from Deb with my doc program to Brenda when I'm a young scholar, an emerging scholar at the university is just, it's wonderful. So I'm just happy to be here. And Diana, if it's easier, if you want to just control my slides, I'd support that, and I'd appreciate it as well. Thank you. So next slide, please. So when I'm going to tell you about how I built my research agenda, and I'm going to talk about it from three different areas, because I think there were three experiences or three types of experiences that really led me into the work that I do now and the field of home visiting. So the first is practice. So I started in home visiting actually as a safe care specialist. I was a training specialist, and my job was to go into the homes with providers and certify them within this home visiting program. And so Safe Care is a home visiting program that is really, it tries to improve parent-child interactions. This is for children between the ages of 0 to 4. So I'm in the home, I'm certifying the providers. This gives me a chance to really see the evidence-based intervention in real time. So I could see that the changes that were being made. I could see the growth. I could also see the relationship that was building between the provider and the parent. And it was really good to see it in real time. And it also created more questions as I saw this in real time. And so as I'm in the home and I'm looking at the services and seeing the positive outcomes, I'm also noticing, populations that are underrepresented or underserved. And one of those populations was fathers. And so, it got me interested in, okay, I know that we have home visiting and I know that it's evidence-based, but who does it work for? And whom does it work for? And so that was a question that I had. Also in this work, I was exposed to the different challenges of implementing, evidence-based home visiting programs, especially in community settings. And so I think one of the things on the slide, you'll see that I worked with Safe Care on a virtual version of Safe Care so that we could try to reach more families in more ways. And so I was all in and I was like, I have so many questions, I need them answered. And actually my supervisors encouraged me to get go to receive a doctoral degree. And so I started a doctoral program and was really focused on how we make services better for families. So it led me to several opportunities. I had lots of internships and lots of opportunities to work in the community, but also to work with other colleagues. And so Deb was telling you that we met through the Doris Duke Fellowship for Child Wellbeing, which is one of the best opportunities I've ever had personally and also professionally. Why, you ask? Such a great question. Because I was able to be in a cohort with about 50, well, it was 15 of us, and we were from different disciplines. We were all working towards our doctoral degrees, but we were all interested in child well-being. So we were together, we were challenging each other's ideas, we were helping each other on projects, we were really wrestling with the questions of home visiting from different disciplines, but in real time. And it was such a wonderful experience because these have become lifelong friends as well as lifelong colleagues and partners. And so alongside the fellowship, we were required to have an academic mentor and a policy mentor. So it showed us, that yes, we are doing the research and that is really important, but we need to be able to connect it to something. For me, through the policy mentor, I was able to connect it to the community, as well as think about the policies at hand that are affecting families that are participating in these programs. And so I had an opportunity to have a mentor that was at the Father Support Center in St. Louis. And so I had all of these research ideas and I would meet with him monthly and my mentor, and he would break down all of my ideas. He said, yeah, that sounds great, but that in real life, that wouldn't work. Think about, what really needs to happen. Talk to the fathers, talk to providers. And so it really gave me that opportunity to realize that, I might have a wonderful idea, but I have to start going to the people who it's going to impact to even make it an even better idea. And so that was really important for me. So all of this time, I'm training, I'm learning about the things that I need to know when it comes to home visiting and how to, again, improve the delivery of services. It's at this time that I really started to think about how parenting programs could be used to reach more diverse audiences. So I'm thinking audience like families of color and families involved in child welfare and foster care. And so I also wondered the role providers and organizations played in the success of these programs. So by the time I began my time as an assistant professor at University of Maryland, I really started to focus my efforts on more community-based work. So this is work, again, that really focuses on either community-based organizations or child welfare-focused populations, because I wanted to know how we could adapt these programs to really fit families of need. And the last piece is personal. And I think that all of our work drives us through a personal lens in some capacity. For me, it's my father. So he is, when I think of parenting and parenting programs and thinking of parents, I feel like fathers are oftentimes not included in the landscape or even in the idea. And that wasn't my situation. That wasn't my reality. I had a very close relationship, and I have a very close relationship with my father, and he is a parent. And I wondered how much more successful home visiting and parenting programs could be if we really put more focus on engaging fathers and making them a part of the conversation. And I'm not just saying that because I'm my dad's favorite, which I totally am. He's never really said it, but and I'm thinking, and every time I saw fathers in the home visiting services, they really thrived. And it was like, what would happen if we put more effort in including fathers? Next slide, please. I also think that my work is inspired just out in the world and the things that I see and that I do. And so I was in Seattle and I went to African American Museum and I saw this picture and it's called, the title of the picture is The Untold, or painting is The Untold Story of the Marginalized Matriarch. And it really struck me because I felt like this was reminiscent of the work that I wanted to do. So they are papers for child support. And you'll see a mother, you see painting her nails, and it really what struck me was the decree there. And I was thinking about how fathers are often viewed when thinking about parenting and parenting services, that they're just financial contributors. And yes, financial contributions are important, but fathers are also parents, and fathers of color are parents. And so we really, in every aspect, have to think about how to engage underrepresented populations in the work that we're doing, especially in home visiting, because we know that research shows that fathers, being a part of their children's lives, improve their outcomes. And so just this visual of how we change the narrative is really important to me, and that also guides my work. Next slide, please. So as I'm building my research agenda, I think it's important to know that all of the studies that I've been a part of have really built on one another. And so it'd be nice to say that I just had all of these wonderful ideas all at once, but no, it was trial and error. It was exploring these studies, thinking I was going in one direction, but the findings and talking with participants that really led me into my next area. So one piece, the first piece that I really started with that's most interesting to me in the beginning of my earlier studies was how do we increase parent engagement? And so I'm thinking, as we're looking at the effectiveness of home visiting, parent engagement is really important. And I'm not talking about just a warm body in the room or someone who attends all the sessions, because that's one part of engagement. But if parents don't believe that the home visiting services are going to work, if they are not active in between the sessions, then they're not engaged. And so I wanted to reimagine what engagement looked like for parents. And so a lot of my early studies looked at the components of engagement and what helped parents be fully engaged in programs. My studies have found that flexibility has been really important. Flexibility with logistically, and especially with parents who are involved in child welfare, because if you are you're participating in home visiting, but you also have court visits, you also have other obligations. And so you may be very interested in the program, but you have other obligations, competing obligations. I also noticed and found in studies that relationships really mattered. So even when parents had lots of obstacles or lots of competing responsibilities, if they had a strong relationship with their provider, they were more likely to participate in sessions and also endorse home visiting to friends, families, neighbors. And so, as I was looking at parent engagement, I wanted to see a little bit more about the role of the provider-parent relationship. And so as I continued with studies, and again, I'm looking at different home visiting programs. So we're talking Triple P, PMTO, and others. I was finding the same thing across the home visiting programs, which was relationships really do matter, specifically between the provider and the parent. And so this was really important for underrepresented populations. So again, fathers, families of color, and those involved in child welfare. And so, I found that this relationship was important. And I think it's because this relationship served as a social support, and it was a really collaborative relationship. And so the most effective programs had provider-parent relationships that were not transactional, but collaborative, where everyone's ideas were heard, and that this was a working relationship. And I also wanted to broaden it out and see if I could find that same, I call it that home visiting feeling with both foster parents and birth parents, and wondered how their relationships could be impacted by trying to increase and improve their relationships. And so I've done that in some other studies, but I think a lot of this really was founded and based on the work that I did in home visiting. So I know I looked at parent engagement, I looked at provider-parent relationships. This also led me to think about the role that organizations have, really increasing the success of home visiting programs. And so I started to explore how organizations support providers and to deliver home visiting services, and how they also support families. So what policies are in place? how are organizations understanding community context? And so this really had me thinking about more studies of inclusive efforts from organizations, so that it makes it easier or even more appetizing for parents to want to be engaged in home visiting services. And so now some of my most recent studies have really looked at anti-oppressive approaches and techniques that provide organizations can be trained in, so that everything that they're doing, they're taking an equity lens. And so their policies, their practices, their interactions really do have they're inclusive in nature. And so I'm looking at this now across child welfare agencies in Maryland. Next slide, please. So I've talked to you about, the building the research agenda, but with this agenda, especially, and I'm in academia, this comes with challenges. And so I really wanted to be able to talk about those, and hopefully we'll discuss them in the larger group setting. But I came across three main challenges. The first is justifying the why. So as I was starting my work, I found that a lot of questions and a lot of pushback came in the form of why fathers, why families of color, why community context, why is this important to include everyone? And so it just having to answer that question and justify the need for fathers or communities of color, families of color, it was surprising to me because I feel like I live this life. And so I see the why, but having to justify it had been a challenge and something new for me. Also in this work, as I'm looking at families of color, I started to see service disparities. And so there were, you have an evidence-based home visiting program. Well, why is it not working for everyone, or why isn't everyone engaged? And so what brings about these disparities? And so even though that's not what I thought that I'd be looking at, knowing that that is happening and being able to highlight those discrepancies and talk about why there's even more need for training for providers has been challenging at times, because oftentimes people don't want to, acknowledge the service disparities. Getting them on board and getting them to have a better understanding of that is important. I think the last piece is understanding the time that it takes to engage in community engaged research. I think it's really important. I think that's where the field needs to go, because I remember a participant, a parent was telling me, look, I think it's really important that everyone be at the table, because if you're not at the table, you're on the menu. And that always stuck with me. And I thought, wow, the research that I do should be community engaged, but it also takes a lot of time. It takes a lot of time to get people, to get their buy-in. It takes a lot of time to get folks in the door. And I'm talking providers, families, community members, and such. And so it takes a lot of time. And what do you do when you are on a tenure clock, but you know that this research is important? And so trying to balance that was a challenge for me. Next slide. So I don't believe in challenges without talking about opportunities. So in these challenges, there are opportunities. So the first is when I was talking about exploring the why and having to justify it. I think an opportunity that I found was trying to find the connections within my work. So I could see this building of a puzzle almost, and trying to figure out how my work fits into not only home visiting, but also fits into other areas, public health, psychology, other fields. And if you could start to see and start to connect those dots, I think your work yields richer findings, and it's just, you'll get more buy-in and more opportunities to work across fields, which is really important. I think the second and third piece that are up now is seeking mentorship. So to have two mentors on the call now is just really important, and just shows that you need more than one mentor, because no one person can be everything. And so it's really wonderful to seek different mentorship in different stages in your life. And also with seeking mentorship, having a no committee. So if you see on the right-hand side, you see that no button. Brenda was a part of my no committee as I was going up for tenure. And so what I would do is a group of three professors. And so we would meet, you know, every so often I would tell them about my research agenda and the things that I wanted to do. Because I was almost like, have you ever seen that movie? What is it? Everything, Everywhere, All at Once? That was kind of what I wanted to do, everything, everywhere, all at once. And my no committee would say, okay, well, what's your research agenda? You know, what's your focus? And then they would help me say no. And so having that no committee, whoever those people may be that can help you think about the bigger picture and then what you're trying to do and if it stands in line. I appreciated the no committee so much that I actually have a button on my desk that's the no button, except it has a little bit more colorful language. But it's a great visual reminder of can't do everything everywhere all at once. And so it's really important to stay locked in and stay engaged. The other pieces would be the collaborations and the network. So if you see on the bottom right-hand side, making these connections through fellowships, through these other opportunities, they have lifelong effects. So bottom right-hand corner these are folks from Doris Duke. So they're from all different cohorts, all stages in their academic life. We decided that we were going to start doing writing retreats because it was really important for us to write together. We're all in similar fields. So about twice a year, we come together at different locations across the US. We're very, very nerdy. We love a good t-shirt and swag. So we'll create t-shirts and we'll come together for 3 or 4 days and we're writing and we're talking about ideas and we're linking each other. We're making connections. And so these things are really important. If you'll see the picture in the middle, some folks from Doris Duke and from other fellowships, we connected and we worked together on papers, in presentations at conferences. It's even allowed us to even delve into conferences and different research projects that had we not been connected. And then the last slide, please. All of this, I think, can be, and I know can be found in HEART. And I think this is a really wonderful opportunity to be able to really hone in and really utilize all of these opportunities. You'll have this connection with other scholars, mentorship, people to help you really grow and most importantly, challenge your ideas. Thank you.
Okay. So before we go into the last segment, first of all, I want to thank Erica and Deb. Deb first being, of course, our home visiting maven who is encouraging us to really focus on some specific questions in the field, encouraging you all, the early career people. I've made my decisions about what I'm going to spend the rest of my career on, but for you all to really break through some of these important questions. And of course, Erica, who is an excellent model of how to build a home visiting research career and get tenure and sort of keep true to her own sort of overarching mission of doing community engaged research for diverse populations and populations who haven't been given the appropriate attention in the home visiting and other service worlds. So we want to just take a little bit of time for you all. If you have any questions or reflections for these two presentations, just give you a little opportunity to ask those right now before we go into our final segment. You could put them in the chat if you'd like. And maybe I will just start us off and say, Deb, from your perspective and Erica from yours, what would be sort of the overarching suggestion you would give to these early career folks in terms of perhaps choosing a content area, perhaps getting specific kinds of mentorship? What would be your sort of takeaway message to them? Just one sort of takeaway message. And I know that's hard.
Yeah. Just ask the easy questions, Brenda. I think you have to be true to what your passion is. Ask yourself, why do I want to do this work? What do I care about? Because if you don't have passion about your questions, I would think because it's not going to be an easy road. You're going to have to sort of navigate some difficult pathways. And I think, starting, what is interesting to me? What is it about this I want to do? Do I want to look at the operation of the direct program? Do I want to look beyond the program and figure out what it can contribute? And then in terms of mentors, pick people that have diverse perspectives on your passion. Don't go to the person that agrees the most with you. Spend some time talking to people that disagree with you, that don't think this is a particularly useful pathway to go. Because I've found in my life that, if you surround yourself only with people that tell you you're brilliant, it's great, oh my God, that's fantastic, you're going to accomplish a lot less than if people really challenge you and say, you need to go a little deeper here, this doesn't make sense. So that would be my 2 cents.
Thank you, Deb. Erica?
I agree with that. I also am a visual person, so I like to think about what type of mentorship do I need. So when I was thinking about it for a position in academia, I was like, I need I need a mentor to help with teaching, with scholarship, someone who's recently been tenured, and some of these folks were not even in my subject areas or topic areas. It just helped me think about that. Also, I had a mentor who was specifically in my area of research that helped me think about questions and projects, and really just kind of push my ideas. Another thing is working groups. So if you can find any type of groups of scholars who are working on similar things, you all just coming together to meet, to discuss ideas, or even work on projects together, even small projects, can really open you up to different opportunities and really help you think about the type of questions. They'll help you really form your questions, even without necessarily realizing that they're doing it. Something about being in company with people who are wrestling with the same questions that is really helpful.
Thank you. Thank you to you both. Efren, I hope I'm pronouncing your name correctly.
Yes, yes, you are. So I'm a data analyst at a community-based organization here in the San Joaquin Valley in Central California, and I am interested in engaging in scholarly research. Unfortunately, the organization does not have a trained workforce, team of researchers who engage in this type of work. What would be your best recommendation in how to go about and perhaps approaching faculty members or a policy analyst at nonpartisan policy think tanks? What would be your best approach in introducing myself to these professionals and ask for a potential research collaboration?
I'm going to start, Efren, and then I would encourage Deb and Erica to respond. First of all, Efren, you are in a very tough position. I just want to acknowledge that because I've worked with lots of analysts and folks at nonprofits, and the fact that you don't have a research community at your agency is always a challenge because there's not people who support you, who understand necessarily what you're trying to pull off, and their mission is different. The mission of a nonprofit is to serve. And so the resources, the attention are going to go in that direction instead of building like a database infrastructure. So I wanted to acknowledge the tough position you're in, but I want to say, just like Erica went from challenges to opportunities, the opportunity you have is that there are many people in the academic setting who would bow down to you, who would say, Efren, please, 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 because what you have that people in academic settings don't have is access to, the constituents. So before you go to that policy research place, I would encourage you to collaborate with a faculty member at one of your local institutions who has an interest in your work, and you start your collaboration there, because that person can, one, give you the support you need, help you to think about who these agencies might be in your area, but also help you to get to your next steps. And I think that if we went straight to the policy groups, which you could do, I think it would be more challenging. But let's say you wanted to skip the whole academic collaboration. A lot of times these policy think tanks, research think tanks mostly, are very interested in people like you because you've had the connections with the people on the ground. So a lot of them do local and state evaluations. See if you can get connected to one of those, because they're often interested in people with your type of experience, because you know how to speak to the local agencies and to the state agencies. So look for projects that are more localized and see if you can get in there. I mean, a lot of these bigger ones, as you know, focus on national, evaluation. So you might want to think about some of the middle ones. And a lot of them, even though they're in DC, Ephraim, now are all remote, because if they want to do a project in California, they need somebody in California. So I would encourage you to even look at the ones in DC who are often, their bread and butter comes from federal funding, but they also do a lot of state and local projects, and see if you can get in that way. But
Yeah.
Deb and Erica, any other thoughts? All
No,
right.
thank you so much for your feedback. I do appreciate it.
Yeah, I appreciate your position.
Hey, well, I was brought here to establish this database system because at the organization we utilize a system called Child Plus,
Oh
and
yeah, I know Child Plus.
and essentially my primary role is to submit monthly reports to the state government agencies that support our program. And of course, I collaborated with my supervisors in developing a professional growth plan. And I made it clear, and I have the support of my supervisors, that I would like to now spread out and engage in this type of research. So, because our program was funded through legislation that was supported by research, these researchers identify a need for our clients, and that's essentially how it was brought about, like how this program was started. But I will look into uh, approaching my local faculty members here at Cal State Bakersfield, and we'll see if there's a possibility there, because it's Cal State Bakersfield. It's not a research one institution. I can see
Right.
of institutions that people put in the chat, and those are R1 schools, the majority of them. So an R2 school primarily focuses more on teaching, not
Right.
research. So
An organization you might want to contact in California too is West Ed. I don't know if you have heard of them, but they do a lot of state and local work around early care and education. When you said Child Plus, I know exactly where that comes from. So they do a lot of work in that area. So you might want to see if there's a way for you to collaborate with some folks at West Ed too.
hey, I appreciate that.
Yeah. Any other questions or reflections before we go to the next segment? Or even from Erica and Deb, if you want to say anything before we move forward. Okay. All right. Well, let's go on to the next slide. So Deb, of course, I stuck this here. I am so sorry because I thought it was a good segue to the next part. So of course it would have helped had I told you that I moved it. So I'm sorry. So Deb had started to talk about where do we go from here, and I thought it was a good segue to the next slide, which is where do we go from here for early career. So Deb sort of gave you the broader picture, and I thought it was such a good way to start that I moved the slide and forgot to tell you, so I'm sorry. So you can go ahead to the next one, Diana, I think. So we wanted to talk about where we as HARC members are planning to go with respect to early career researchers. So first of all, we are going to do some more webinars. So this one was sort of our opening one to sort of jumpstart us to get a connection with some of you and to get to think about what we wanted to do. So we're planning to think about issues like work-life balance, which is an important issue, and it sort of does address Erica's no, and somebody in the chat said they were going to form their own no committee, which is great. We also wanted to work on diversity, equity, and inclusion issues, and perhaps think about research methods and data sources for those of you who want to do home visiting research. In fact, our next webinar will be in April, and so you should get something from us about that, and it will start to take the kind of deep dives. As I said, this one was a jumping off, a launching point, but we're going to take some deep dives into particular areas that we think would be of benefit to early career researchers. So that is one next step. Another next step, we're working with another member of the leadership team of HARC to develop a special interest group for early career researchers that's part of HARC that would meet and really think more carefully about what we want to do for early career researchers as HARC, but also, you know, really hearing from you and creating the kind of networks that Erica talked about and that Deb talked about in terms of Doris Duke, so that you have a place to go to kind of address the issues that come up for you. We also have an annual meeting of HARC, and we're hoping to have early career researchers be a part of that. And so certainly we wouldn't be charging you to come to that meeting. So that's another opportunity. And Deb and I are also working on a pilot, if you will. That's why we put small there, a mentoring program for early career home visiting researchers that we hope to launch over the summer. So you'll be hearing more about that. There'll be applications, etc. So I wanted to take, those are what we have planned, but we also wanted to take this opportunity to see if you all had any other ideas that would help us meet your needs as early career researchers. So certainly you can put them in the chat, or if you'd like to come off mute and sort of share any other ideas that might help us to meet your specific needs, we'd appreciate that as well. So I just want to take a moment for that.
I have an idea that is like a little bit half-baked, if that's okay.
Half-baked is absolutely fine.
I'm thinking about if there's a way to connect early career researchers based on kind of general research interests and thinking about promoting collaborations if someone has data but not time, et cetera, to build kind of new working relationships between folks.
Okay, that is excellent. And we certainly can try to take those ideas and, you know, do a little more baking. But I like that because, you know, certainly Deb and I have thought about this small program, but if we're really thinking about something that can happen like with those of you here, I think we should try to do that. And I see Diana is certainly saying that please, we are having a March 7th webinar that will take a deeper dive into some of the things that Deb was talking about on emerging issues. So put that on your calendars, and that might be a way to begin to do some of the things that were just suggested. But we can also try to take the people who've come to this session, but also other people who've expressed an interest, and see if we can't create some kind of collaborative streams there as well. So thank you for that.
Alexandra, you're thinking about bringing people together based on topic or question, or I'm just,
Yeah, I mean, I think it probably could vary.
okay.
I was thinking about topic, I guess.
Okay.
But I think it could, yeah, look a lot of different ways in terms of matching up research interest.
Yeah. Great.
So it could be topic, but then as you were saying, can you share data sets or
About that
inform each
topic,
other?
though. Yeah.
Or
Right.
funding, yeah.
About that topic.
Yeah.
The other thing I want to reinforce that Erica did, and I completely forgot about this, is these writing groups they brought together in the fellow, and that was totally fellow developed, fellow driven, where they would get together and say the biggest stumbling block we often have, and those are, for those of you that are in an academic career path, can be around just putting pen to paper and writing papers and having a group of people that support that process. I mean, those writing retreats were amazing. And sometimes they did it virtual during COVID. I think that's right, Erica, where people would log in and then they'd come back, 30 minutes later or an hour later. What have you written? What are you talking about? That kind of peer encouragement is, I think, very important in just sometimes getting people through that initial block or concern of taking what can, for some people, be a pretty difficult first step.
And it sounds like what Alexandra was saying was there's also like your meeting needs, like for instance, if there's data that's available, but maybe somebody doesn't have time to actually analyze it, that you're bringing people together to do that. So it's meeting needs too.
Mm-hmm.
Yeah, I'm thinking especially about the challenges of doing community engaged research on a tenure track timeline, for example. This could help early career researchers have access to data that has already been collected while they're continuing to build their own partnerships that might take a little bit more time.
Alexandra, that is such an important issue you raised, and Erica might remember our conversations about this. I think you have to be on a parallel track. So if you can do those low-hanging fruit that come from existing data sets, or collaborations with other faculty members who don't have time to write a bunch of stuff, but might be happy to have you take part in some of their own work while you're doing the whole long-term 5-year sometimes strategy of trying to develop these relationships is so important for tenure, certainly. Any other ideas or thoughts before we move on? I just wanted to give everybody an opportunity to share if they had any about how we could meet your needs. Okay, I'm not seeing anything. So let's go on to the next slide. So just again, as a first step, one of the things that you all can do is be a part of our practice-based research network, which, has a goal of really engaging folks to participate in research opportunities, kind of like what Alexandra was saying. There are many people who are doing many different things and would be happy to have someone who is early career and wants to get a paper out to try and push data, or do a joint grant or something like that. So please do consider that. It's not specific to early career, but one of the things you all heard me say that we're thinking about is creating this special interest group for early careers. So this might be just a first step. As part of the PBRN, you get the monthly newsletter and early access to any study findings. And then, of course, as I mentioned, you get to be a part of special interest groups. It could be the early career one we're talking about, but there are other special interest groups that you could get involved in. And of course, continue to be a part of webinars and annual meetings. So anybody who really wants to expand your network, I know a lot of times in your settings, whether they're academic or clinic-based, or even like Efren, who was at a small community-based agency, you often don't have peers who are doing this kind of home visiting research. And as both Deb and Erica suggested, you can do this in a different setting, but it is much more beneficial if you have a group of peers who understand the nuances of this work, the methods of this work, the funding for this work, and can help you take advantage of the opportunities that are out there. Okay, you can go on. I'm
Brenda,
sorry.
I was also going to say, through the annual meetings, we've now added early career, not even a track, but an opportunity for early career scholars to present. So this gives you a chance to present your work, to receive feedback, and the conversations and discussions are really helpful. And folks are engaged, the audience is really engaged. And so I know last year we did it virtually, just really great conversation, and another opportunity for you to connect and also receive feedback on your work.
Mm-hmm. Absolutely. Thank you, Erica, for bringing that up. Okay, and just our last slide. Just want to thank you all for joining us, and please do this evaluation for us. There's the QR code right there. And again, I just want to bring up that we are having a new webinar. This is not specific to early career, but certainly a way to learn. It's doing a deep dive into one of these emerging issues. And this particular one is looking at a financial empowerment intervention within a home visiting program, specifically parents as teachers. So that is, one step toward understanding how to do these kind of very challenging evaluations where you're looking at the addition of an intervention to a traditional home visiting program. So please do join us for that. With that, I will thank you again. This is so exciting to have a bunch of early career people here with us, and we will continue over the next year to do things that we think will help, build this new cadre of home visiting researchers that we want to see. Anything else from Allison or Deb or Erica before we close? All right. Thank you all.